Greetings and hello there. My group, which consists of Prissalya, Sabina, Howdong and myself Scott, will be presenting about the medication Perindopril. The reason we chose this drug or medication is because around the dinner table, one conversation that comes up very often is the medication everyone's on. Perindopril at one point was heavily discussed as both my grandfather and father were prescribed with this medication, even though both of them have very different illnesses. This got me even more curious and enthusiastic to learn about the magic, or as we study, pharmacology, behind this drug. A little background about Perindopril. Perindopril is known as an ACE inhibitor. ACE is an abbreviation for angiotensin converting enzyme. It was discovered by the Servier Research International and was first approved on the 11th of January 2010. Statistics have shown that the demand for Perindopril is on an increasing trend. This could be correlating to the increase of hypertension in the general population.
That was quite insightful, Scott. Now, before we move on to the pharmacological aspects of the medicine, then let's talk a little bit about the Renin angiotensin aldosterone system, or RAS for short. In response to various stimuli that are associated with low blood pressure, the granular cells in the juxtaglomerular apparatus release renin. Renin initiates RAS, which leads to the activation of angiotensin II, hence blood pressure. RAS allows a fine-tuning of body water homeostasis. Rising blood pressure, body water, and sodium content is a cumulative effect of angiotensin II. It does so by mainly three mechanisms. First of all, cardiovascular effects. In order to achieve vasoconstriction, angiotensin II acts on AT1 receptors located throughout the circulation in the endothelium of arterioles. The net result of this is to increase the overall resistance of the periphery and therefore the blood pressure too. Secondly, neural effects. Angiotensin II serves to induce the sense of thirst in the hypothalamus, leading to an increase in fluid intake. The secretion of ADH from the posterior pituitary gland also increases, leading to the production of more concentrated urine to minimize the loss of urination fluid. Renal effects. Angiotensin II operates on the kidneys to create a number of effects in the proximal convoluted tubule, including afferent and efferent arterial constriction and increased sodium reabsorption. It enhances the preservation of sodium and changes the way that the kidney processes blood. In order to improve blood flow and blood pressure, this increased water absorption in the kidney occurs. Now, let's move on to the pharmacodynamics aspects of Perindopril. Angiotensin converting enzyme, or ACE, are the active participants of RAS. They are distributed primarily in the lungs and kidneys. ACE molecules have two functional domains, the N domain and the C domain. Angiotensin I binds to both domains and undergoes proteolysis into angiotensin II. Perindoprilat, the active moiety of Perindopril, competes with angiotensin I for the two active domains on ACE, thereby decreasing the proteolysis of angiotensin I to angiotensin II. The renin secretion no longer increases blood pressure.
Moving on with pharmacokinetics. Pharmacokinetics can be simply described as the study of what the body does to the drug. For almost all drugs, the magnitude of pharmacological effect depends on its concentration at its site of action. There are four main processes involved in pharmacokinetics, which are absorption, distribution, metabolism, and elimination. Together, they are sometimes known as the acronym of ATNI. Now, we'll explain about the pharmacokinetics of Perindopril. Firstly, absorption. Oral administration of Perindopril results in peak plasma concentration that occur at approximately 1 hour. The absolute oral bioavailability of Perindopril is about 65 to 75%. Following absorption, Perindopril is hydrolyzed to perindoprolate, which has an average of 20%. Peak plasma concentration of perindoprolate are attained 3 to 7 hours after Perindopril administration. Oral administration of perindopril with food does not significantly lower the rate or extent of perindopril absorption relative to the fasting state. However, the extent of biotransformation of perindopril, the active metabolite perindoprillate, is reduced approximately 35%. Next, distribution. Approximately 60% of circulating perindopril is bound to plasma protein, and only 10 to 20% of perindoprillate is bound. Therefore, drug interaction mediated through effects on protein binding are not anticipated. Moving on with metabolism. It is extensively metabolized with only 4 to 12% of the dose recovered in urine following oral administration. 6 metabolites have been identified: perindoprillate, perindopril glucuronide, perindoprillate glucuronide, a perindopril lactame, and 2 perindoprillate lactames. Only perindoprillate is pharmacologically active. Perindoprillate and perindoprillate glucuronide are the 2 main circulating metabolites. Lastly, the route of elimination. Perindopril is extensively metabolized following oral administration, with only 4 to 12% of the dose recovered unchanged in the urine.
From the homely medicine to the most sophisticated prescription medicine on the market, all drugs come with side effects, so as perindopril. Many are minor, some are serious, and some are just plain strange. Perindopril is a medicine used to treat high blood pressure and heart failure. This medicine is only available on prescription. It comes as tablets. To find more about this drug side effects, we have divided them into 2 categories, which are common and serious side effects. Firstly, we look at the common side effects, which are dry, tickly cough that does not go away easily, feeling dizzy or lightheaded, especially when you stand up or sit up quickly. This is more likely to happen when you start taking perindopril or if you move on to a higher dose. Headaches, diarrhea, mild skin rash. Lastly, let's look at the serious side effects. Any sign of bleeding, like bleeding from the gums and bruising more easily, sore throat or getting infections easily, can be a sign of a blood or bone marrow disorder. Shortness of breath, wheezing, and tightening of the chest can be a sign of lung problems. Severe stomach pain can be a sign of an inflamed pancreas. Swollen ankles, blood in urine can be signs of kidney problems. Weak arms and legs or slurred speech can be a sign of a stroke. Also, in rare cases, it's possible to have a serious allergic reaction to perindopril.
Finally, you may ask if there is any alternatives. Well, there are 6: Avapro, Atacand, Losartan, Lisinopril, Enalapril, and Binicar. Disclaimer: always consult a licensed healthcare professional or doctor before purchasing these alternatives to prevent any misconception, as every drug information are subject to change and is not intended to cover all users but most. Here's our reference slide, and thank you very much for listening.